Hello and welcome back. I am Connie Wray and I'm excited to be your moderator for our fourth episode of Talk It Out Tuesday. It's a weekly interview series where Crisis Support Services of Nevada partners with experts to dive into some of the most current issues concerning families in crisis during the COVID-19 pandemic. And in our fourth episode of Talk It Out Tuesday, we are going to be talking about the impact of the pandemic on multicultural populations. And there have been recent reports showing that throughout the US, Hispanics and people of color are being hit the hardest and impacted most by COVID-19. And to discuss this issue a little further with us today, we have Oscar Delgado. Oscar is the CEO at Community Health Alliance and also Reno City Councilman for Ward 3. And also with us, Crisis Support Services of Nevada's Executive Director, Rachelle Pellissier is here as well. Good morning and good afternoon.
Good
And
morning.
welcome to both of you.
Hi, Connie. Great to see you. Hi, Rachelle. Great to see you as well.
Nice to see you. Thanks for joining us.
We'll just kind of dive right in. Oscar, some questions for you. Recent numbers released by the Washoe County Health District showed coronavirus is disproportionately affecting the Hispanic population in Washoe County. It really is mirroring the trend that is not only across Nevada, but really nationwide. And as reflected across the state and nation, Washoe County numbers show that Hispanics are 25% of the county's population. They make up 36% of the local coronavirus patients, and advocates really fear the disparity between Hispanics and other groups could be greater. And some of the reasons we may not know this is, second most common option is, we don't really know, but there's also Hispanics that are not noting their ethnicity. But when we look at, in contrast, Caucasians, they are 63% of our population, and they represent 29% of the COVID-19 cases. And Oscar, we're hoping that you can kind of explain or shed some light on why this is happening.
Yeah, thank you for the question, Connie. It's unfortunate, really, for the families and the communities that are being impacted across the way. I mean, as stated before, there is no real discrimination with what COVID is doing, but there is science related to those that are going to be impacted and who is being more impacted. When the zip codes and the data started to present itself, I knew certain communities were going to be impacted more than others. It's sad to say that, but numbers and data are starting to show that that's real. And so really here's an opportunity where we can really in the immediate make sure that our communities are informed about all safety procedures, what CDC guidelines are stating, and what our health district is suggesting, but it's also what are we learning from now in order to prevent other outbreaks in the future. And the opportunities really for us is, especially among those communities of color, many of them are essential workers. We still have quite a few workplaces that are still at work, and what I mean by that are your warehouses, your construction workers, your fast food workers, your people that are being exposed throughout the day, and then they go home. And then sometimes they go home to multi-generational homes where you have grandma there, you have a baby there, you have another family living there. And again, a lot of them are your salary-based job, they're your hourly. And so sometimes these folks are going from one place to another and they're coming, and unfortunately they are exposing the rest of their family to this. And to your point earlier, the second largest impacted community is unknown. And from direct communication with the community itself and also to other public health experts, we know that there's a fear of reporting, especially within the Latino community, which again is a public health issue for all of us to consider and think about, because if people aren't being treated and they are sick and they may be hiding those symptoms and they're not seeking help, then they're going to continue to get other people sick. And so what we'll see is we won't see a flattening of the curve, we'll see an increase of the curve.
Along those lines that Oscar is alluding to, that we've got people out there that are afraid to reach out. They're so afraid because of all the issues that Oscar just relayed, and they do not know how to reach out and how to get the help safely. And that's what Crisis Support Services is here to really help people in a confidential way to reach out, and we can support them through the crisis, but we can also help them to get the services that they need.
If you are undocumented or you are in this position, how are the hospitals reacting and responding to that? Are these individuals getting a response that's positive so they are feeling more comfortable, or is this something that we really need to look further into?
I think we're doing a good job in terms of preparing and getting information out, especially in Spanish, and trying to find people out there and find venues to provide information. I did a town hall through the city of Reno on Facebook Live, all in Spanish, which we did. It was really, really successful, which means to me that people are thirsty for more information. We did one with the county and several others, Cortez Masso, several other experts and doctors through the county on a Friday that went live on the CW and a few other channels, all in Spanish, which means to me that we're making strides in understanding that people need information and they're thirsty for information. So you're getting people that are getting a lot of their information from social media. And then we all know with social media, sometimes it's not the most correct, updated, fact-based information. And so that's something else that we're dealing with, is making sure that people get the real information, the real data in terms of how to get resources. But there's still that huge scared element out there that's really prohibiting people from either seeking help because it's going to be something that's going to hurt their opportunity to become a citizen, or it may impact their paycheck. If they go to work and they're sick, then they're no longer going to get that paycheck on Friday. And in many different ways, they feel as though there's no one advocating for them to seek out whether they qualify for that unemployment check, or how are they going to advocate a push on that landlord to make sure that they're not evicted, because they're going to be scared to ask for support if they are going to be evicted possibly, because they don't want to, again, crawl out from under the shadows. And so again, it's a public health issue with respect that if they're not seeking help, or if they're sick, then potentially they're going to work, then potentially others in our community are going to get exposed as well.
One of the things that we have recently implemented to try to get this information out to the Hispanic community is all of our advertising, our Facebook advertising, all of our blogs that we've put up in the last couple of weeks, we're translating into Spanish. We've already done one about mental health and one about domestic violence, so that we do have the information out and they know where to reach out and get the services they need.
It's amazing. Thank you for that. People are starting to see that that's an opportunity to really engage and inform the community. That's a conversation I even have with the city council at times, right? It's how are we making sure that the households know that they're part of this community? And it's about communication. So thank you for doing that.
Oscar, you are the CEO of Community Health Alliance. Could you give us a brief description as to what Community Health Alliance is?
Yes, so Community Health Alliance is an FQHC, a federally qualified health center. And so what really that is they're community health centers in your neighborhoods. They were created in the 60s as an opportunity of fighting the war against poverty. And so really what they are, they're innovative, creative way of getting primary care into those neighborhoods. What we have is 7 clinics throughout Washoe County, where we serve up to 30,000 patients, individuals across our county, and where we provide primary care. So you see a doctor, you see one of our medical professionals. We also provide behavioral care. You see one of our licensed clinical social workers. And then we also have dental care for our kids. And so we provide all those primary necessities as a really safety net for so many of our working families across Washoe County. And now you also have those available in Southern Nevada as well. There are other FQHCs, several of them, and you could find that list through the Nevada Primary Care Association. If you visit the website at nvpca.org. Again, that's nvpca.org, and you'll see a list of all the other FQHCs across our state that provide similar resources and services that we do here in Northern Nevada.
What are solutions that you are proposing as we move forward in response to the reality people of color are facing as it relates to access to healthcare? Because that really seems to me to be the core of this issue, is access to healthcare.
And so what we can do as a community is be supportive of policies by wearing masks in the immediate, washing our hands in the immediate, doing the social distancing in the immediate, but not forget about the lessons learned right now during the pandemic. Other ones are to be advocates and work with those elected officials that are trying to pass some of these really hard issues that can be very contentious, but hopefully thinking long-term versus short-term gains in terms of what is this going to mean for us to turn the curve and hopefully put these communities in a different place than they are right now. And another piece of that too, I just want to say is how important it is to support so many of our partners that are doing the good work, such as all the work you guys are all doing. Because government can't do it alone, but our community definitely is stepping up. So many nonprofits are stepping up to fill those voids, and it kind of again shows the importance that they're there and that we continue to support them in the long run.
The other thing that I'm really hoping after all of this is said and done is that when we come out of this, we reevaluate the importance of having agencies such as crisis support services, what a value it is for us to go back and collect this data later on, how many calls were made to crisis support services in regards to others, multicultural individuals that were dealing with COVID, domestic violence, those that are suffering from depression and anxiety. I think an overall health spectrum of what our community health is like is what we need to really focus in on. And that's what I hope to see. That is the only way we're truly going to move the needle and make healthcare a priority, I believe, in our country. Is that if we really look together at all of the services. I mean, one of the joys of crisis support services is that if, for example, you are Hispanic and you believe you have been exposed to COVID, that you can call anonymously and you can get someone at crisis support services that is going to get you in touch with the right service. And then that individual will have that data so that we can go back and really get an overall view of how this all came together, and in the end, what can we do so that if this happens again, we can truly make a significant difference the next time around.
1,000%. Very well said, Connie. I support that 100%. 100%.
We want to help people before it's a full-out crisis. Statistics show if you have a place that you can call and be listened to and then get support through, then you are less likely to get to a point where suicide or hurting yourself or someone else seems like the only way to get out of that pain. So we want to make sure everyone knows that we're there 24/7, 365 to help you, whether you're in the highest level crisis or you're just so anxious that you really can't think of the next step.
You have translation services that are available. And I think the biggest thing that we should mention is that you will partner with appropriate services, whatever that individual is in need of, whether you're having a bad day or you really are in crisis, that crisis support services works diligently with other agencies so that we can find the right help for you.
If you're in the rurals, we're going to get you to the services in the rurals. If you're in Southern Nevada, we're going to get you to services there. And if you're in Northern Nevada, the exact same thing. We're going to get you to the services that you need.
Going to wrap things up, but I'm just wondering, Oscar, if you have any final thoughts in regards to what we've talked about today. And again, just thank you so much for taking the time and for working so diligently with the Hispanic community to get the information out there. And I appreciate your honesty in educating us about how many in the Hispanic community are getting their information and how important it is that we get the correct information out.
I think we're all just trying to get the information out. We're all trying to go home to a safe family, and we're all trying to go to bed at night without all these other stressors. And so thank you to everyone that's doing the great work out there. Continue to do the good work. We'll make it out together. We are going to do it together. And I love being in this community, knowing that everyone's standing side by side and making sure we do it together.
If you would like to get in contact with Crisis Support Services of Nevada for assistance to find services in your area, there are several ways that you can reach them. You can reach them via 1-800-273-8255. You can also text CARE to 839863. And of course, you can also visit their website at cssnv.org. And I would also like to remind you that Crisis Support Services of Nevada is a nonprofit organization. They are helping Nevadans. They are helping people across our nation. And if you would consider making a donation, we would love for you to do so. And you can do that by, again, visiting their website. You can go to cssnv.org. And just to give you an idea, those donations are so greatly appreciated. We are seeing immense volumes of calls right now. We have so many workers that are working 24/7. They're working longer shifts, and this money is greatly appreciated because that money goes directly back to the care of our community. So we, again, greatly appreciate that. Thank you so much, Oscar Delgado with Community Health Alliance and also with our City Council here in Reno. And also, again, to Rachelle Pellissier. She is the Executive Director of Crisis Support Services of Nevada. We thank you both for taking the time to be with us here today. Thank you.